At Blackstone Physical Medicine, we see patients all day, every day with chronic pain. One of the most common conditions we deal with is knee osteoarthritis. This can be quite debilitating and often prevent people from doing what they want to do. In the field of regenerative medicine, we try to avoid corticosteroids because we know the long-term side effects associated with those. We also like to try to delay or postpone knee replacement if possible. One of the problems with steroids, it can cause weight gain, increase your blood sugar, affect your cortisol levels, and also decrease your bone health. Unlike anabolic steroids, which are only good for you, there's nothing wrong with adding on tons and tons of muscle and looking great. Like this guy. Definitely not bad on your heart. Definitely not going to die early. Today we're going to talk a little bit about plasma concentrate. It's been investigated in the use of knee osteoarthritis. It also goes by the name of autologous conditioned serum or autologous protein solution. Not to be confused with plasma exchange, which is also called ambrosia, and that's where you take young person's blood, put it in an old person, and helps them feel younger. The way we obtain plasma concentrate is we take 100 milliliters of whole blood, we run that through a centrifuge and separate the red blood cells from the plasma. Then we take the plasma, we run it through a system where we take the water out, so we concentrate the plasma down to a fraction of the volume. This way we filter out the unwanted parts of the blood, same way people filter their face for their Instagram photos, you know. So what's so magical about plasma concentrate? Really nothing. Magic doesn't exist, it's an illusion. The plasma concentrate has growth factors, proteins, cytokines that can help in the arthritis process. So we're merely trying to concentrate those and put them in the joint. This is still a relatively new procedure and we're still learning about what's involved in this process. So two key factors in plasma concentrate that we think play a role in the arthritis process or in shutting down the arthritis process are alpha-2 macroglobulin called A2M and interleukin-1 receptor antagonist protein called IRAP. Alpha-2 macroglobulin can inhibit some of the enzymes that are involved in the breakdown of cartilage in arthritis, and IRAP blocks an inflammatory cytokine that plays a role in osteoarthritis progression. So this is still a new procedure and we don't understand all the details. It's still being investigated. One of the earlier studies was in 2003, and a study done in Germany on 1,000 cases. They saw that about 75% of the people had improvement, and their improvement ranged anywhere from 50 to 100% for knee osteoarthritis. They also checked back in a few years down the road and still saw about 30 to 40% of the people with sustained benefits. Anecdotally, we have seen good results with plasma concentrate in our patients. Symptoms improve, pain improves. We know that platelet-rich plasma seems to do better based off some of the trials in mild arthritis, so plasma concentrate is a nice option for an in-between plasma or a platelet-rich plasma and a bone marrow stem cell option. And our patients seem to do well with this procedure. Feel free to check out our website for more information, and we'll see you next time.